you're saying that you say this is all about compassion
And I'm saying that only 3% of those who pay, which are your businesses, your corporation, 3% of the population is putting out that money to take care of the bottom 97%. But they have the loudest voice. They're buying our democracy.
I'm going to go back to this $65, which is what Delta said it will cost them per employee. So why? They're going to have to pass that cost on now.
Yeah, of course.
So this is going to be, all of a sudden, people are going to be hurt a little bit more in their pocketbook as well.
My question to that is the $65. If there was no Obamacare, the insurance companies would have it up way beyond $65 anyway.
So, Bart, you hate the insurance companies. We got that. Okay?
No, he's
we got
talking.
That. However,
I'm talking about facts.
However, I don't think we should be forced to take anything, and that's what's happening. And it's not affordable, and it's wrong. We're not even going to have good health care. It is socialized.
We're going to have better health care.
I'll tell you what.
I like your point about not being forced to do anything. That's a conservative idea that the individual mandate makes it work.
Hey, hang on one second. I'm going to call and we're going to take a quick listen to what the president has to say. How about that?
Sure.
On October 1st, if you don't have health care right now, you can join what are called these marketplaces, and you'll be able to get lower cost health care. Here in California, it's estimated it'll be 20, 30% cheaper than what you're already getting.
20 to 30% cheaper.
Happening already in California.
Yeah.
California rates are going down.
Just
New
rhetoric.
York, a recent study in New York looks like the rates are going to be going down. And I think it's going to work, and that's one of the reasons why the psychology of the politics is so hot.
But I need to go back to, that's a sound bite that we just heard from the president. I still have to go back to this $100 million that it's going to cost Delta. I mean, how do you?
And that's one example. Everyone's going to hit across the board. The big businesses, the small businesses, especially the middle class, they're the ones that are going to go out of business. They can't afford Obamacare. They keep saying this, Jackie, over and over again.
They have to supply health insurance. If your business is big enough, you have to supply
and guess
health
what?
insurance.
If it's a certain number, that's where they're moving it back because it's so unpopular.
Let me ask a question. What about having continued coverage until you're 26 years old under your parents' coverage?
26? It's ridiculous.
Dr. Bart, I'm just going to go again.
It's a great idea because the more people who are covered means that there's going to be less people going to the emergency room costing us to pay for them.
But why can't a 21-year-old who's working, a lot of them do work full-time?
Well, a lot of them don't have full-time jobs. They're going to school. They have not yet been accomplished enough to get a full-time job. So you can get coverage at a low rate because they're young through your parents' policy. Therefore, there's less people uninsured. If everyone's insured, we all save money. And that's the concept, and it's a conservative concept.
Jackie?
Ladies and gentlemen, do you know what the average age of a child moving out of their parents' household is now in 2013? Any guesses?
It's not good because Obama's terrible.
Yes. Give me a guess.
I'm going to say 25.
It's still not right for a 26-year-old to be dependent on her parents. It's ridiculous.
32.
Oh, bull.
Why?
I don't even believe that.
Because of the economy.
Exactly. Thank you, Obama.
These 21s, and thank you, George Bush, for preceding Obama.
That was like 5 years ago.
Because there are no jobs, because millions of these young people are going to fall through the cracks and not have any health insurance, and that's ridiculous.
Well, where I'm worried about people falling through the cracks right now is the fear of Obamacare, and a lot of companies have certainly come out and stated this, that they will go to take all their employees, or a majority of their employees, to 30-hour or less work weeks because then they won't be required to give them health care insurance.
That didn't happen in Massachusetts with Romney Care.
It's not going to happen.
It is going to happen.
It's a good point that you're making, but it's not going to happen.
It's already happening. They're saying, look, we cannot afford this. So they're saying
threatening.
Yes, because they can't afford it. Obamacare is a huge job killer. These businesses are going to go down because of Obamacare. And guess what? Yeah, sure, it's going to be 26-year-olds old because nobody's going to have a job. Nobody can afford to live. And it's not the way it's supposed to be. It's all about the economy. And then this is taking down jobs. And it's ridiculous for a 26-year-old to be dependent on their parents.
Now, I just did want to talk about Mitt Romney very quickly because he did state that threatening a government shutdown could cause Republicans to lose control of the House in 2014. Dee Dee, thoughts on that?
Disagree. I think, look, if something's wrong, we fight it. We should fight it tooth and nail. This is terrible policy. It's killing our country. It's just not affordable and it's wrong. So I'm sorry. Mitt Romney's wrong. He didn't have a good election. Yeah, he didn't win, and he's wrong.
And Jackie, you're a media analyst, so I'm just
Yes.
going to say a lot of folks that I talk to, and I think I have a pretty nice group of friends who are pretty intelligent, but there's confusion. Do you think that the media is just not handling this well?
No, it's money. It goes back to money again. The anti-Obamacare forces has spent millions of dollars, 3 times as much in publicity, in ads to get the message out.
But this is, I'm talking about just the media.
Exactly, but you have to pay, as you know, for your media time.
No, we don't pay for talk shows and things like that. I'm talking about...
Right. But there has been a media campaign, commercials, etc., to have that confusion. Obama himself has said, to answer your question, that he thinks that the normal media have not stepped up enough and described what is really going on in Obamacare, all the details, and there is cause for confusion there. But I want you to pay attention to the amount of money spent to smear Obamacare by the forces that be, and how now Obama's people are going to put even more against that, which I think is all wasted money. I think what we should do is let it happen. It's going to soon go into effect, and then if we love it, we love it. If it falls apart, you win.
Well, I don't think we really have a choice at this point, but Dr. Bart?
I say that the political psychology on this issue is rich. It's dynamic. And Republicans want to have an issue against Obama. It's their wrong issue, because this makes a lot of sense if you really look at it, but they don't want to buy into that.
It's not
because
about
they
Obama,
want
it's about the policy.
The policy will work. The policy will reduce rates much better than insurance companies would, and they'll pay the doctor and they'll provide the service for the patient. And that's what's going to happen as time goes by, and Democrats know that, even though they know it's a problem right now for them, and Republicans are fearful of Obamacare. It might just work. That's going to be a problem for them.
Dee Dee?
That's not it. It's the policy. It's not the politics on this one. It's just really bad policy, and Americans are hurting, and people are going to have to go out of business. They're going to have to go to part-time jobs because they can't afford full-time jobs. I mean, when the unions are against it, you know you got a problem.
There was the same argument against Medicare, and Medicare is something everybody embraces now.
No, I don't. I think it's way over the top.
This is the biggest overhaul since Medicare and since 1965, and I think there's just, I would probably say there's just more confusion and questions. I just don't think, from the people that I've spoken to and interviewed, I think there's just a mass confusion and a fear from the unknown.
There is fear.
I think that's true, but the millions of people in California who are now uninsured will be insured by Medi-Cal in California. Those people will be insured, so if they have part-time jobs, this will actually help them get more jobs. So it's going to be a job saver.
Already.
It's not going to be a job killer.
No, it is.
Certainly a lively discussion on this one. Lots of different opinions. Thank you, everybody. Thank you for watching, everybody. We're going to switch gears now, and when we come back, we're going to plug into a new topic. We're talking about electric cars. We'll take a look at the Tesla that is accelerating in the ratings department.